People ask me all the time kind of what makes the difference between a DO and other people. And I always go back to what my mother said early on. We think differently than other people.
Rich does think a little differently, but the way he thinks is very consistent with our osteopathic philosophy.
What makes Dr. Jermyn a phenomenal educator is that he regularly incorporates the psychosocial aspects into patient care.
So when I started my career, I wanted to get involved. This was the mid-90s. It was the peak of the AIDS crisis. People were dying. And I wanted to be part of that. So I actually got involved with the infectious disease groups, and I started doing end of life and pain management. That's actually how I got into doing pain management.
Quite frankly, during this time when there is this whole issue with the opioid abuse crisis, Rich has been at the forefront of training future physicians how to really handle this crisis and handle it well.
So a big part of why I do substance use, this is the same disease as HIV. It has the same stigma. It has all the same issues that HIV had in the day, right? And so we have to treat those patients. It's who we are. Right? So you want to stay focused, because if you had a sensory abnormality there, you're going to a cranial nerve, and it's really not, right? So just stay focused on that, keep going. So what happened was, as we started doing proper prescribing and training physicians and students and trainees, meaning residents, on how to do this right, one day I came into the office and I said to my faculty, we're going to start doing substance use disorder, because if you put people on opiates, you have to take them off it. So we started writing the grant. And I didn't think it could ever get funded. So we had tons of fun writing it. So I said, throw in gay men in that, throw in transgender, throw in sex workers. By the way, the dean doesn't know that, surprise. And we got it. It was amazing. This year we've got about close to $10 million in active funding on training and education programs.
Not only is he impacting directly on the care that we're providing to the community in southern New Jersey, but also his impact in training physicians, nurses, and other health professionals will really translate into an impact that will have far-reaching, even nationwide impact.
As a student, Dr. Jermyn has influenced me by making me think that next level of depth into everything that I'm doing. So rather than accepting at face value the treatment that we're doing for our patient, say, is this the best treatment? And is there any other option that we could use? Is there any research that is not done yet that we could be doing to better our patient care?
I want the very best for our students and our patients. And that's exactly what Dr. Jermyn, what Rich represents.
The best thing I do every day that makes me come back to see patients, research, all of it, is teaching students. To me, that's my legacy. I tell my students this all the time, they're actually my children. And that, to me, is my future.